Hey guys, welcome back to my YouTube channel. So today's video can be broken up into 3 different parts. The first part is applicable to anyone who is currently in school. It doesn't matter what level of education you're currently obtaining. I'm just going to be talking about some generalized study tips that everyone across the board can use. The second and third parts are going to be more tailored towards medical students. I'll talk a little bit about how I study for basic sciences versus clinical sciences and just some generalized time management tips for medical students as well. And the reason I chose this topic today is because this is something I've had to learn throughout my educational career. So in undergrad, I thought the same study tactics from high school would work, and that wasn't necessarily true. And then I thought the same study tactics from undergrad would work in medical school, and I also found that not necessarily true. So in undergrad, I really needed to have effective study methods and efficient study methods. I needed to have efficient study methods because I was juggling 2 very demanding things. Being a student who was trying to get into medical school, which is very competitive, and being an athlete at the Division I level, which is very competitive in itself. So I really needed to be efficient because I had less time than the average student to do the same amount of work, and I was going to be looked at the same as someone who was a non-athlete in terms of the application process. I was expected to have the same GPA, I was expected to have the same MCAT score in order to put me on an even playing field. And then I needed to have effective study methods because not only did I need to do well in my classes, but I needed to have a solid understanding of that so that I will be able to apply it on the MCAT and do well and get into medical school. So you guys who listen to me kind of often know that one of those went a lot better than the other. And so I would say that my study methods were efficient. I was able to get a decent GPA and also perform well in athletics. However, I wouldn't say my study methods were effective because while I was able to get a good GPA in college that put me on an even playing field, I did very poorly on the MCAT, which means that there was probably some type of disconnect between comprehension and understanding. And this is something I had to learn on my own. So I hope that these study tips and just time management tips can help you guys get a better sense of how you learn and how you can become a more efficient studier, because that will automatically translate directly into better time management. So first things first, you need to figure out what type of learner you are. And the reason you have to do this is because nowadays there are endless resources for any single topic. There are thousands of books, hundreds of podcasts, and there's no shortage of videos on any single topic. So it can be very overwhelming. And so by knowing what type of learner you are, you're going to be able to at least focus on what resources are going to help you learn the best. So there's a bunch of different types of learners. There's visual learners, there's auditory learners, kinesthetic, repetition, scribble, question, answer, the list goes on. You really just need to figure out what type of learner you are, and then you can focus on those specific resources. For example, if you are a visual learner, reading, pictures, videos are probably going to be your go-to resources. If you are an auditory learner, perhaps videos, lectures, or podcasts are going to be the way you retain things the best. If you are a scribble learner, you can either break out the old school notepad and pencil, or you can use your iPad. There's tons of apps where you can make your scribbles on your iPad apps instead. And you can even use the most undervalued tool, which is the whiteboard. So from there, once you know what type of learner you are, you can determine your resources. And this little section is going to be tailored towards medical students because the examples I'm using are the ones I'm most familiar with. So if you know that you're an auditory learner, listening, for example, to the Golian pathology audiobook might be something that works really well to help you learn pathology. Listening to lectures in class is going to be very helpful, and group discussions or small group presentations, as well as podcasts, are things that are probably going to benefit you. So those are the things you should start investigating. If you're a visual learner, guaranteed when it comes to micro and farm, you're going to absolutely love Sketchy Micro and you're going to love Sketchy Farm. It's very visual and there are tons of memory hooks, and you're probably going to fare out very well from this. Pathoma, another way to learn pathology. Dr. Sitar does a lot of drawing, so this is really good for visual learners. And when you're learning anatomy, Netters is going to be your best friend if you're a visual learner. So again, if you're a visual learner, start investigating some of these resources before you start school. In terms of Scribble, like I said, you can use your notepad, you can use the Notability app on your iPad, whichever you prefer. I do prefer scribbling, so the whiteboard was my absolute go-to. This is one of the golden tools of medical school. So if you are a Scribble learner, a whiteboard is going to probably be your best friend. And personally, I used some note cards as well. So that's something you can also do. In terms of repetition, obviously flashcards are going to be your best friend. And if you are a question and answer learner and you learn best strictly from question and answer, obviously when you are closer to taking your step 1 exam, doing UWorld is going to be the best resource for you. But if you really, in basic sciences, are trying to do a lot of practice questions, most professors will post a set of their own for the week online. And then there are also some textbooks you can use for extra practice questions as well, such as the board review series called BRS, Guyton and Hall, and Pretest. And so the next thing is just some generalized study tips. And again, these apply to everyone, no matter what level of education you're at. First things first, repetition. The more times you review something, the better you're going to know it and the more second nature it is going to be. You're going to be able to answer whatever question that is just a little bit faster, and you will just be more comfortable with the material the more frequently that you see it. So whether it is memorization or just reviewing concepts, the more times you look at these things, the better you're going to know them. Next general study tip, question and answer. Honestly, no matter what type of learner you are, doing question and answer before an exam is important because the chance of your exam being multiple choice is pretty high. So whether you're a visual learner or an auditory learner, a scribble learner, whatever type of learner you are, you should be incorporating practice questions at some point as well, because that's how you're going to be tested. And this is going to prepare you for the exam. In addition to helping you prepare for the exam, it also promotes long-term memory retention. So you have all of these facts in your head and you read a question stem, and your brain needs to pull from all different parts of the brain to come up with a solution to that problem. And that really helps with long-term memory retention. The other thing is if you get the question wrong, no one likes getting the same thing wrong twice. So you're going to be less likely to get that question wrong in the future. One, because if it was a concept you didn't understand, now you do. And two, if it was just something that you did understand but you may have misread, you will be a little bit more meticulous when you're reading the question next time. The other thing for multiple choice questions is that it really helps you with pattern recognition. The more multiple choice questions you do, the more you're going to be able to think like the test writer. And when you're studying, you'll know what's important for the exam. It's also going to help you recognize things that you think you understand, but you don't. Multiple choice questions will point them out to you. The other thing is if you think you understand something, great. But if you can't apply it, again, the multiple choice question will definitely let you know. Next generalized tip, teach it. It's long been said that if you think you understand something but you can't teach it, you don't understand it well enough. And that's pretty true. Especially in medicine, you're going to be teaching students when you're a resident, and you're going to be teaching residents when you're an attending. So having a good teaching basis not only is going to help you comprehend the material that you're learning, but it's also going to prepare you for your lifelong career in teaching, because while medicine is lifelong learning, it is also lifelong teaching. Even if you have no interest in getting involved in academics whatsoever and you manage to avoid it, you are always going to be educating your patients, and you're always going to have to explain complex medical conditions in layman's terms. So you're always going to be teaching. You can't avoid it no matter what you want to do. Group studying is another generalized tip that I think is really undervalued, and I think there are pros and cons to this, and I wholeheartedly understand why. The pros are that if you self-study all the time and you're creating your own notes and you miswrite something, and that's on the exam, you're going to get it wrong because you miswrote it in your notes. Or if you think you're approaching something properly, but actually you're missing a step or you flip-flop something, you're not going to know unless you have someone to correct you. So while discussing it with another person can sort of help you from that aspect, you also will benefit because there might be concepts your study mate doesn't understand. So again, that's where the teaching comes in. It can even turn into a question and answer session. So group studying can be very beneficial, not only because you will recognize things you don't understand, but you'll also be able to incorporate some other useful study tactics as well, which, like I said, question and answer, you can quiz your friend, and teaching, you can teach them things and then they can teach you things, which reinforces the information for both of you. The cons to group studying, which I understand because I was this way, is if you aren't comfortable with the information that's being talked about in the group, it is very easy to feel overwhelmed and just overall sad and stressed out when everyone is talking about a topic that you don't really understand or know yet. And so this can be overwhelming for a lot of students. And like I said, I know I was this way. So my personal solution to this was to self-study throughout the week. And when I became comfortable with the material, I would group study, because then if there was a concept I wasn't understanding from self-study, one of my colleagues would be able to explain it to me, and vice versa. I would be able to explain concepts that maybe they didn't understand. So again, I think group study has its pros and cons, but overall there's usually a solution to the con. So it's something that I would probably recommend as well. And really the last generalized tip I have, which is a huge problem nowadays, is limiting your distractions. So it is difficult because a lot of people will take notes on their laptop or take notes on their iPad, which are connected to the internet and Facebook and your text messaging. So it can be really hard to separate them. My personal solution to this was airplane mode. There are now apps that exist that you can select which apps to shut off while you're studying. And so this might be a useful tool for some people as well. But overall, limiting your distractions is extremely important. Once you break your concentration, it's very difficult to pick that up again and run with it. So just limit the amount of times that you're distracted in the first place, and you will finish your work a lot quicker and you will retain a lot more. So the next part of this video is going to be dedicated to a topic that I get questions on literally all of the time, which is time management in medical school. How do you balance maintaining good grades and staying in shape, for example? Literally a question I get probably like once a day. So all of my secrets are going to be unveiled here, and if they work for you, great. If they don't work for you, I am sorry, but I think for the most part they can kind of help everyone, at least in some way. One of them will help you. First thing I recommend is reflect on how much time it takes you to do tasks. And by tasks, I mean going through a lecture. How long does that take you? Answering your 10 practice questions. How long does that take you? The first semester of medical school is different in the sense that you are still learning about yourself. You will learn what study methods work for you, so that won't be as much of an issue as you go forward. But the first semester is going to be very difficult in terms of time management, because you have to figure that out, and then you have to take the time to reflect on how long it does take you to accomplish tasks like going through a lecture or answering your practice questions. And the reason this is important is because my biggest secret for having good time management is I schedule absolutely everything. I wouldn't survive without my planner. I schedule literally absolutely everything. And you can schedule things much more effectively if you know roughly how long it's going to take you to do that task. And you'll get a really good sense your first couple weeks of medical school how long it's going to take you to accomplish different tasks. So by the end of your first semester, you'll have a pretty good sense of how long your homework, essentially tasks, should take you. You'll know which subjects you need to spend more time on. You'll know which subjects you don't need to spend as much time on. And the more tests you take, the better you're going to understand which information is actually important for the exam. So you will get faster with your studying probably as you progress throughout the semesters. And if not, that's also okay. But generally speaking, I think when you learn how you study the most effectively, you won't be wasting time on resources that don't work for you, which is going to help you with time management. And then once you get a good sense of what topics might take you a little longer, what subjects might take you a little longer, you'll be able to schedule them a lot better. And so by your second semester, you'll probably start feeling a little more comfortable with your time management in school in general. So the next 3 tips I have in terms of time management are kind of interrelated. And the first one I already mentioned, but it's a huge problem nowadays, so I feel the need to mention it again, and that's decrease your screen time. It's not uncommon for someone to come with me and say, I'm having trouble getting through lectures, I need help with time management, and I ask them to look at their phone and see what their screen time is, and it says 7 hours. Well, you're spending 7 hours on your phone, so of course you're not getting through your lectures. But even something as simple as cutting that back to 6 hours, by decreasing your screen time 1 hour a day, that's enough to get you through probably almost a whole lecture for most people. So you're going to catch up on your work a lot quicker, even just by decreasing your screen time for an hour. So the next thing is prioritize. And this is, I guess, my golden secret for maintaining good grades and also staying in shape. And it's because I genuinely make working out a priority. I make time to work out every single day, no matter what. That's my choice. That's my priority. Is it going to be your priority? No. Should it be? Not necessarily, not if you don't want it to be. But if you want it to be a priority, you have to actively make the efforts to make it a priority for yourself. For example, when I was in basic sciences, there are days where I was super busy, and if I needed to start going through a lecture while eating dinner or while eating lunch, just so that I could gain that extra 30 to 45 minutes to get a workout in, I would do that. Is everyone going to do that? No. Some people really just enjoy having a meal and they find that very relaxing, and that's fine. But that was a way that I was able to fit working out into my schedule. Likewise, some people want to watch an episode of a series they're watching on Netflix after class to let their brain recuperate before they go post-read in study hall. And that's fine too. But recognize that that's the priority that you're making. Working out for me is like Netflix for someone. It helps me clear my head, it re-energizes me, and it helps me refocus. So that's really just the biggest secret I have to how I maintain both, because it's a question I get very frequently. So does working out have to be everyone's priority? No, of course not. But if you want it to be, you just have to make the active efforts to make it your priority. And so the last thing in terms of time management tips is what I call time-based tasks. And this goes in with scheduling as well. So like I said, once you know how long roughly a task is going to take you, you can put an hour to an hour and a half or however long it takes you to accomplish a lecture, for example, or to go through your 20 practice questions, maybe it takes you an hour. You can schedule that in yourself. But for me, when I was in basic sciences, what I would do is it took me about an hour to go through each lecture. So I would set my timer for 50 minutes on my phone on the days that I would take it, or I would set my stopwatch because I have a running watch. And I would just go through the lecture, focus, no distractions for 50 minutes, and then take a 10-minute rest before I would go to the next task. And time-based tasks are helpful not only in terms of schedule, but because they really help you focus and they motivate you to get things done, because your brain thinks that you only have this small amount of time to do it. However, don't get stressed out if you don't finish said task, because as I'll talk about in a little while, on the weekends is where I would do my overflow, or for example, in the mornings, maybe I would get up and eat breakfast and finish going through a lecture. So the last part of this lecture is going to be, again, covering a topic that I get a lot of questions on, and that's how did I study in basic sciences? In basic sciences, I took the pre-read lecture post-read approach, and basically what that means is I would pre-read every single day before lecture. And pre-reading doesn't mean you're trying to understand anything. It doesn't mean you're going to be researching whatever topics are going to be presented. That's not what it's for. Honestly, you're not even really reading. You're kind of just opening the lecture slides, flipping through them, looking at the pictures and the titles of the slide, just to be seeing what's going to be covered that day. And what this does is it sets up a framework for your brain to just have a logical pattern of what's going to be being presented in lecture. It knows what's coming next, it knows what topics are going to be being covered, and it will be able to pull information from whatever the lecturer is saying a little bit better. In terms of lecture, the majority of the time you spend in lecture should be spent actively listening. That means listening to what the professor is saying, asking yourself questions like, why is it like that? Perhaps the lecturer will then explain, why is it like that? And if not, maybe you should put a star on the side, figuring out why it's like that when you post-read. But the majority of your time should be spent in lecture listening. I know a lot of people are typing away, but realistically, everything that's important is already on the lecture slide. So if there's something that you think that might help you as like a memory hook that the teacher might have said, scribble it down or go back and replay the lecture later and you can re-scribble it down. But for the most part, everything that they say is on the slide because the slides are given to you because they want you to pass the exam. The last component, which is post-reading. And what the heck is post-reading? Post-reading is honestly the reason that a lot of medical school interviews will ask you questions about self-motivation and things you do to help motivate you, because in reality, the majority of the time you learn in medical school is going to be on your own. Most of your learning comes from self-study, and it comes from post-reading. And so what is post-reading? Post-reading means that you're going to be comprehending, solidifying, and understanding everything that was just presented to you in lecture that day. This comes in a variety of formats. It can be reading up on the topic, watching videos on the topic, going back through the notes, creating your own notes, drawing pictures, whiteboarding, question and answer. There are tons of different methods that you can use to post-read. Everyone's a little bit different. Like I said before, know what works for you. But whatever method you're using, make sure that it is an active study method rather than a passive study method. Because if you're using a passive study method, you're just going to have to go back over the information again anyways, and you essentially just wasted some valuable time. And so something that's common amongst medical students in terms of passively studying is they want to create their own notes, either written or typed. And so they look at the lecture slides and they literally type exactly what's on the lecture slides while looking at them in a different format. And that's extremely passive, and it's a waste of time because you're going to have to go back over those notes. To make it a little more active and to make your time a little more worthwhile, what you can do is look at the slide and perhaps just look at the title and recall as much as you can recall from lecture on that concept. Write it down in your notes, whether you type them or write them, and then go back through the slide and see if there's anything you missed, any details you didn't get, anything you didn't necessarily understand the first time, and then add those to your notes as well. That way it's sort of quizzing yourself and you're making it a little bit more active, and you're also still making the notes that work well for you. I commonly get asked what my approach to basic science studies was, and so I'll talk a little bit about that now. What I used to do is pre-read, lecture, post-read every single day. What was my method of post-reading? My method of post-reading was, like I said, setting the timer for 50 minutes to go through the lecture, and I would use index cards. And I would put important information onto the index cards, quizzing myself in the process. And this was usually like a broad or general overview of whatever the lecture was. So then I would do that every single day. On the weekends, I would do a second pass of all the material. And while reviewing everything I learned that week and quizzing myself on what I learned that week, I would also go back through some of the lectures and incorporate some details that I think were important or that I might have missed through my first pass of pre-reading. I usually went through all of my lectures on Saturday, and then on Sundays, I kind of reserved for my labs. I would do all of my labs on Sundays so that I wouldn't have to worry about doing them during the week and I could just focus on post-reading. I would also use Sundays to do practice questions that were posted for that whole week, and I would do those and review those. And then in the evenings, I would usually get together with one of my colleagues for an hour to an hour and a half, where I would do group study with them and either whiteboard out topics or just quiz one another and discuss different topics that were being covered in lecture from the week before. When it came to the second week's material worth of an exam, I essentially did the same thing, except I would try and fit in a second pass of the first week's material. Obviously, it will be a little faster because you know it a little bit better. And then I would focus mostly on whatever the second week's topics were and incorporate details onto my note cards just like I did for week one. I would also do the practice questions on Sundays. I would also review with my colleague on Sundays, and I would whiteboard. By the time I got to my final semester of basic sciences, I was also doing a lot of teaching, and I was up to like 6 to 8 hours a week. So not only was I listening to lectures, reviewing my note cards, whiteboarding out concept, group studying, but I was now also teaching. So like I said, I took a multi-dimensional approach to basic sciences, and it's something that I think helped me. Do I think it will help everyone? Not necessarily, but I think just seeing information from a bunch of different angles is something that benefited me. Finish this video off, I'm actually going to be answering a question from the audience that I thought was really interesting. And so it's a two-part question. So the first part of the question is, what is one thing that I did in medical school that I wish I did in undergrad to make me more successful in terms of my grades? And that's a pretty easy question for me to answer because it's easily practice questions. Not that I did bad in college, but looking back, I understand why I was so much better at calculus than chemistry and physics. And that's because chemistry and physics, I would read from the book. And calculus, we were assigned practice questions, mandatory practice questions, every single night. It was so annoying, but in retrospect, now that I know how valuable practice questions are, that's definitely why they were assigned, because you were practicing exactly what was on the exam. So it's no surprise that my grades were better in that class than every single other class. The second part of the question is similar. It's what's one thing that I think I learned in clinical sciences helps you learn better than in basic sciences. And I think the answer to that question is real life application. I think in basic sciences, you're learning so much information, but you're only able to apply it to fake patients and question stems, whereas in clinical sciences, you're actually seeing these cases being presented on the wards, and you're going to remember how you managed your patient or what their diagnosis was or how they looked and what their symptoms were. You're going to remember that much better when it's in real life than when you're just reading it from a textbook. So that's all I have for today in terms of general tips and time management and studying for basic and clinical sciences. I hope that this provided you with some valuable study tips and some valuable information, not only on how I study, but how you can better approach a massive amount of material as well. So as always, don't forget to like, don't forget to subscribe, and don't forget to follow me on Instagram.